Hello guys, what is up? Welcome back to Simplified by Genial Shah. Today we are going to cover a remedy called Diptherinum. One thing that we usually do is we break up the word of the remedy in the name itself and try to derive at a meaning. So we'll do that. First, very obvious is diphtheria. And second, more interesting, and that would help us for the remedy is numb, which is also similarly sounding to the word numb, right? Now, interesting thing to understand is in today's day and age, diphtheria is extremely rare, and because we have such good vaccines available for it, so directly you finding a patient with diphtheria and then prescribing diphtherinum might be rare also, but that gives us a clue that if diphtheria is so rare and people are getting vaccinated, then who is likely to get this illness, right? So who would be likely? Somebody who is already exhausted, who has weak vitality. When we study vaccines, we say that if you are sick, if you have fever, you're not supposed to take vaccines because that is when your immunity is already low and you may catch the disease if it's a live vaccine, of course. So, diphtherinum by itself, because the disease is so rare now, the vaccines have almost eliminated it. Most likely, you would find it in people who have very weak vitality, very low constitution, who are exhausted, right? Second thing we understand is since we don't get diphtheria cases, but we could get similar cases with other pathology where your throat is involved or diphtheria like symptoms are there. So, suppose you come up with a patient and he tells you that I'm not doing so well, I am very weak, and the patient is in semi stupor, very sleepy, very drowsy, but the patient is not in coma, right? He is aroused when spoken. So, comment down what it would be in Glasgow coma scale, because the person is aroused when spoken to. It's not touch, it's not pressure, it's not pain, but it's just when he's spoken to. So even though the vitality is gone, it's not completely a bad case of in terms of Glasgow coma scale. And he comes in and you see that, oh, something is majorly wrong with this person, and you try to understand what is wrong and you ask him, do you have any pains? And he would say no. Why? Because there is sensation of numbness. There is no pain. Even the diphtheria is painless. Now, if there are no symptoms, then what do we look for? Is signs. When there are no symptoms, we look for signs. And Diptherinum is a drug where you do not have any symptoms, but there are only objective signs. So here comes your knowledge of examination. Right? If I have to do a basic throat examination, what do we first do? We ask them to open the mouth. What we get is offensive odor. It's mostly syphilitic in the manner because you see the vitality is exhausted, there is semi-stupor condition, there are no symptoms, it's malignant from onset. It's not like the disease has progressed, it is malignant from onset. So it's mainly syphilitic miasm. When the person opens his mouth, the breath is offensive. It's extremely offensive. Then what do you see next? After he opens the mouth, you see tongue. Tongue is red and swollen. After you've seen the tongue, what would you see? You would see the throat. Again, throat is dark red. And throat includes the tonsils, the fauces, the palate, everything is dark red. Now, when you see the throat, you also observe something which is, there is a thick, dark, grey membrane. And if you study more about diphtheria, you will know what this is. The interesting thing in how you learn about this or how you remember is with use of colors. The tongue, red. Throat, red. Membrane, dark gray in color. Now you've seen the throat, you've observed it. Then the next thing you do is you check for glands. Glands here are swollen. Swollen glands. Quite common and obvious finding. What would be interesting would be these symptoms. Swollen glands is usually a typical symptom of any throat infection. Then, now let us guess what would be the temperature. Of course, the patient would have fever, right? But if we put in our materia knowledge, we see that the person has weak vitality. He has, of course, malignant symptoms. There are obvious signs that show us that the disease is progressed. But what would be the temperature? In a normal person, he would have high grade fever. But since the vitality is exhausted, the reaction from the body is low, the temperature would be low or subnormal. Now, what do we mean by low? It wouldn't be lower than the normal one, but it would not be as high as expected. It will be just slightly high, maybe 99 and 100, that's all. Then you check for pulse, right? Pulse would be weak because again low vitality. And rapid is a normal symptom with temperature. Weak pulse. We already talked about CNS symptoms here. And if we go delve deeper into it, it's STEMI stupor, aroused when spoken to. Now you ask him, okay, you have a huge enlargement in your throat because your tonsils are enlarged, you have a thick membrane around it. Do you have any trouble swallowing food? Because in materia we also find this interesting thing, swallowing food difficult, swallowing water difficult, and he says no, he can swallow easily. So swallowing is not an issue. Now, interestingly, if swallowing is not an issue, you would assume vomiting would also not be an issue because then the passage is clear, right? But vomiting is an issue and the person vomits through nose. Now, this is an interesting symptom. It cannot be majorly justified by why the person can swallow. If the person can swallow, that means the mouth, esophagus passage is clear. There is no good obstruction. But while vomiting, he is vomiting through nose. So this is just a peculiar symptom we can keep in mind. Now, if we are going to nose, let us talk about few more things about nose. Maybe I'll just write it here. One thing that is coming out is fluids, which are being vomited. And second thing that happens is, now let's assume that this is a separate condition where the fluids are coming out through the nose. It's going to irritate the nasal membrane and there's going to be pressure changes which will cause epistaxis. And this epistaxis is profound. Now here again comes the question, if everything is okay, why is vomiting an issue? And materials mention about post-diphtheric paralysis. That's an additional point, but if you remember this much, right, your Diptherinum drug is done, which includes diphtheria-like symptoms that would point us towards major throat symptoms. Then we have to remember that the patient is numb. That comes and gives us the constitution of the patient. Exhausted, weak vitality. It's usually psoric or scrofulous individual who catch on diseases and viruses very quickly. So they are sensitive enough to catch on the disease, but the body's immunity is too low to react to an illness. And the body would go into malignancy since the onset. Okay. And when this patient comes to you, you see that Okay, he has no difficulty in swallowing. It is painless, but you try to examine and you see offensive breath, red swollen tongue, dark red throat, thick dark membrane, swollen glands, and this is the temperature. And these are the objective signs that you notice, and you think, oh no, this patient seems unwell. So the prognosis of such patients who need diptherinum is low, or it's poor prognosis when the patient seems doomed from the beginning. The moment you examine him, is like it's a bad case, plus the arousal is low, the reactivity of the body is low, so the prognosis seems poor. And mostly they also mention that even carefully selected remedies have failed, and then you can try diptherinum. And the last peculiar symptom is about nose, where fluids are vomited and epistaxis is profound. That's it, guys. This is Diptherinum for You by Simplified by Jinal Shah. Comment down below if you want any other drugs or if you want any other information. Like somebody can comment down what are the other signs and symptoms of diphtheria that could be seen in Diptherinum drug. And somebody could also comment down other drugs which have post-diphtheric paralysis, one of which is already there on the channel. Thank you guys. Like, share and subscribe to the channel, and we'll be posting more and more videos. Thank you.